Welcome to the GoalZero Toolbox Talk series. Today's Toolbox Talk: Dermatitis. Dermatitis is a skin condition characterized by hot itchy patches, red, swollen, and tender skin, and sometimes blisters. It can be caused by exposure to substances that irritate the skin or from allergic reactions. The risk of dermatitis is most common on outdoor work sites in rural areas, in enclosed spaces, when working with chemicals and when refurbishing old buildings. Dermatitis is a painful skin condition which can be prevented. It is caused by a reaction to a substance on your skin. Here are some suggestions on how to prevent it. Follow safe procedures when dealing with potential irritants. Always read the manufacturer's instructions for using the product. Refer to the SDS, safety data sheet. Avoid spills and splashes and clean up messes promptly. Wear proper protection for the task. Use the correct gloves or other PPE for the job. Stay clean by using soap and washing your hands and arms. Always rinse your hands and other exposed areas thoroughly. Dry your skin completely with clean paper towels. Use a good hand cream to replace the oils in your skin after washing. Keep your body free of irritants by changing into clean clothes at the end of your workday. Wash contaminated clothing frequently and separately from your other clothing. Never keep an oily rag tucked in your pocket. It can lead to dermatitis under your clothing. Report early signs of skin irritation. Have minor cuts and scrapes treated promptly, because irritating substances can enter the skin through these routes. Report any swelling, redness, or unusual symptoms to your supervisor. The two most common forms of occupational dermatitis are irritant contact dermatitis and allergic dermatitis. Irritant contact dermatitis is caused by substances, such as industrial chemicals, which produce skin inflammation on contact and generally only in the contact area. Irritants include acids, solvents, and strong soaps or detergents. A person with allergic dermatitis has developed sensitivity to a substance, such as poison ivy, rubber, or nickel. This sensitivity may develop after a brief exposure or over several years. Some substances, such as latex gloves, can induce both irritant contact dermatitis and allergic dermatitis. Preventing dermatitis is more effective than treating it. Preventive measures can include engineering controls, protective clothing, and good housekeeping. Engineering controls should always provide the first barrier between hazards and employees. Whenever possible, less hazardous chemicals should be substituted for more dangerous materials. Tools that allow workers to hold the workpiece without having to immerse their hands in process chemicals are another example. Automating a process is another effective means to eliminate employee contact with hazards. Personal protective equipment is a secondary means of preventing dermatitis. Gloves, aprons, long-sleeved shirts, face shields, and boots all reduce the risk of exposure, but they must be selected based on the type of exposure. Chemical protective clothing manufacturers have charts and software to assist in making the correct selection based on the chemical and the exposure potential. Personal hygiene is critical in preventing dermatitis. Employees should wash after exposure to chemicals and routinely before eating, drinking, smoking, and at the end of their shift. An industrial hygienist or occupational physician can be consulted on the best way to cleanse the skin. Harsh cleansers or solvents may worsen rather than lessen the problem. If someone is exposed to contact or allergic irritant, have them wash the area immediately with mild soap and water. Apply anti-inflammatory creams if desired. In severe cases, the individual should consult a physician.